On September 23rd, 2019, I stood on a stage looking out at thousands of you who were standing shoulder to shoulder, hard to imagine now, inside a conference room in downtown San Francisco. And I announced PagerDuty.org's strategic focus, time-critical health, that we were committing our technology, our talent, and our funding to help save lives by reaching people faster. Well, we had no idea how crucial this commitment was about to become. That barely 6 months later, it would be more essential than ever to help reach people faster, to leverage PagerDuty's ability to orchestrate across teams and complex systems to ensure efficient deployment, particularly to the most underserved populations. There has never been a moment in history where real-time response and orchestration to help save lives and advance justice have been needed more than in the past year and in the immediate months ahead. COVID-19, racial injustice, and a U.S. election, unlike any we've ever seen, have presented previously unimaginable problems. And PagerDuty has continuously have been part of the solution. We've taken what we've learned in time-critical health to apply to the pandemic. We know that today in the United States and the majority of high-income countries that getting the COVID-19 vaccination is as easy as heading to your local pharmacy or healthcare provider. But for the majority of the world, there still simply isn't access. 84% of shots that have gone into the arms have been administered in high and upper income countries, and only 0.3% have been administered in lower income countries. So PagerDuty is playing an essential role in ensuring COVID-19 vaccinations are distributed to the most underserved populations and the hardest to reach communities. Knowing PagerDuty had incredible potential to support the complex and crucial challenges around vaccine distribution, we launched a $1 million open call for funding to support equitable COVID-19 vaccine access and distribution. And we are so proud to announce our first cohort of partners, Care Message, Code Tenderloin, and Vision y Compromiso. We're also founding partners of Go Give One, an international campaign to support the Global Vaccine Alliance and COVAX's vital efforts through their network of frontline responders to equitably deliver 2 billion COVID-19 vaccine doses by early 2022. PagerDuty has committed $250,000 through this campaign and is matching your contributions throughout Summit up to $50,000 to meet this goal and safeguard the lives of those most at risk. One vaccine costs $5. To donate, you can visit the PagerDuty.org booth and see the event feed for campaign details. We are committed to helping ensure that everyone has access to healthcare that allows them to thrive, including and especially those who have been historically marginalized. One of our partners invested in this work is NextLeaf Analytics. When COVID hit, NextLeaf began hearing from their healthcare partners in Kenya that patients were dying because of power outages. So although many of these clinics had secured ventilators, the power in small communities in Kenya is unreliable. The clinic staff didn't have insight into when the power would go out in time to take action. So NextLeaf combined the power of their cold trace sensor alerts with PagerDuty's responsive platform to monitor the power that was feeding the ventilators, treating patients with severe COVID-19 infections. In their clinics across Kenya, NextLeaf now uses PagerDuty's incident response to ensure that anytime a power outage hits, the on-call healthcare worker would be notified immediately. And these healthcare workers could act quickly to ensure the power was restored and lives were saved. From ensuring orchestration among healthcare workers to system reliability to innovative solutions around power monitoring, PagerDuty is part of a complex ecosystem to both treat and prevent COVID illness and loss of life. But our work in vaccine equity and distribution is only one part of PagerDuty's broader social impact commitment. We are a Pledge 1% company, which means that we commit 1% each of our equity, our employee volunteer time, and our product to accelerate social impact. And the way that we do this is by pairing our funding, our product, credits, and technical employee volunteer time to help our nonprofit partners and customers better respond to the communities that they serve. Trek Medics is one of these partners that received funding, product credits, and specialized volunteer support to meet ongoing critical health needs as they scale. Join me in welcoming Jason Friesen, Trek Medics founder and executive director. Jason, welcome to Summit.
It's a pleasure to be here. Thanks so much for having me.
Great. So Jason, tell us a bit about Trek Medics. What's the problem that it exists to solve, and how is Trek Medics part of the solution?
Right, so we're a nonprofit, non-governmental organization that improves access to emergency care for at-risk and vulnerable populations through innovative mobile phone technologies, which in short is that we build emergency communication systems for people that don't have the money or the need for your legacy 911 dispatching software. And what we do is that, in this new digital era, everybody has a way to send alerts and everyone has a way to call for help. But there's a big problem when it comes to emergency response, in that there's not a lot of technology out there to actually coordinate the response. So everybody's got alerts and ways to ping people and call for help. But the real question is, now what do we do? And that's what we work on, is we build a dispatching platform called Beacon, which is a text message-based emergency dispatching platform, and it coordinates alerts and tracks responders so they can get to the people when they're needed at the right time with the right resources.
It's incredible. So tell us, let's bring a little bit more color to this. Who are Trek Medics users and your beneficiaries? What are the communities that you're helping to solve, to support? And perhaps some examples of mission critical services that need to be available around the clock.
Right, so we've got a range of users. We support emergency response organizations, but that runs the full spectrum from your traditional ambulance services, EMS agencies, fire departments, to also more niche or specialized response agencies like disaster response or search and rescue, as well as community-based organizations. For example, we work with harm reduction organizations to respond to opioid overdoses. We also work with domestic violence advocacy organizations who respond and provide support services to domestic violence victims. So most of our services are 24 hours, so they're at any time there's a need, they will be alerted and respond. And they are working around the clock, and at this point we're in close to 20 countries.
That's great, including the United States as well, right? Did you get your start, I believe, more in international territories, and then have really seen a growth and adoption of your platform in many different types of environments?
Exactly. So when we first started, we were focused on improving access to care in low and middle income countries. So our first programs were in the Dominican Republic and in Haiti and in Tanzania. And back then it was purely SMS only, and it was simple text messages getting sent back and forth between dispatchers and responders. But as we grew and got more support and funding, we were able to add a lot more to our platform. And now we have a very sophisticated dispatching platform that is being used in low, middle, and high-income countries, including the United States, the United Kingdom, a couple Western European countries as well. So we're definitely across the spectrum now in terms of who's able to use our software and who we're supporting.
So Trek Medics came to be a PagerDuty customer through kind of a unique route. You're one of our time critical health grantees and received funding from our fund as well as product credits, and then participated in an 8-week sprint with specialized Dutonian employee volunteers to help implement PagerDuty. So, what challenges does PagerDuty help Trek Medics solve for?
Right, so PagerDuty works very much for us like we work for response agencies, in that our platform has a lot of different integrations and sub-services that all plug into our stack, and keeping an eye on all of those different components can be very challenging, especially for a smaller team like ourselves. And so what PagerDuty really helps us with is keeping an eye on all of these different services, all these different components, and letting us know well in advance when problems that are happening could turn into bigger problems. So we've got PagerDuty really streamlining all of these services and keeping monitoring going on for all of them so that we don't have to be logging into all these different sites and scouring through logs or whatever it may be to find out what's going on. Instead, thanks to PagerDuty, it's all getting piped into one single stream where when something happens, we know where to look and it'll tell us where to go and search to get the answer and figure out what's going on. So in many regards, PagerDuty is alerting us and then helping us coordinate a response to internal issues, just like we're alerting responders and helping them respond to issues in their communities.
Yeah, I love that, the mirroring of the experience and the service there. So you mentioned you have the small 6-person team, you have global operations, and you're really supporting a complex ecosystem to be able to effectively support first responders in many different scenarios and use cases across a variety of platforms. So what are, when you think about the efficiencies that have been gained through using PagerDuty, do you have any metrics that come to mind that of how you're accounting for measuring the after state having implemented the platform?
Yeah, so again, like you said, the mirroring, the metrics that we use internally are very much the metrics that we use to measure the response agencies using our software. And those are really, one is the number of incidents that are happening. How many times are we having to deal with these issues, and always looking to lower that number. Then two is the mean time to acknowledging an issue. So as soon as we're alerted, how long does it take somebody to acknowledge that this is an issue and that they're on it? And then the third is acknowledging, or the mean time to resolve the issue. And so how long does it take between when it was first noted or reported to when has it been resolved? And so those are very much in line with the same kind of metrics that our response agencies use to measure their own performance in identifying problems and then responding to them.
That's great. So, what are the integrations that you're using today to get the most out of PagerDuty? Perhaps these are integrations that are supporting faster response times and ultimately better health outcomes for the communities that you're working in.
Yeah, so the integrations that we use are growing quite regularly. They're increasing, but the main ones is, of course, Amazon Web Services for our servers. And then we use a lot of integrations for the messaging, both for SMS messaging and for push notifications through the mobile app. And that runs from Firebase for the mobile app and push notifications. Twilio manages a lot of our push notifications. And then we also have Twilio working on managing our SMS. But then there are also a lot of countries where those options aren't possible. So we have to work with local telecoms to set up the communications pipeline and make sure that our messages get to the responders and their messages get back to us. So we've got a real ecosystem, as it were, of different components that are plugging in. And now we're actually working on is implementing so that alerts can be sent to our platform and triggered a response through email. And so now we're working with different providers in terms of what are their emails look like and how do they format it and how can we parse them and make sure that it creates an incident through Beacon to send to the responders. So we're always growing in integrations, and the good news is that PagerDuty can keep an eye on all of them for us. So that really helps us sleep better at night, knowing we've got a way to keep track of all of this.
Yeah, you've given us some great early feedback on the efficacy of utilizing the partnership and having that visibility on memory load and other instances where you can be proactive in ensuring that your own platforms don't go down and continue to support your end users. So Jason, as we wrap today, it's wonderful to be a part of TrekMedic's continued journey, and what an eventful, unfortunately, year it's been with COVID and the many ways that your platform has had to flex to adapt to that. But we have a global community here at Summit, and we'd love to call on them. What can they do to be part of your journey moving forward?
Yeah, thank you so much for that. There are two main ways that we're always looking for help from volunteers or people who may be able to donate some time. One is expertise. So, we've got software developers as the majority of our team, and then we have a whole lot of other things that we need to take care of for outreach, promotion. And so if there are people who would like to volunteer and either get involved with our software development team or help us with promotion, marketing, even setting up, promotional campaigns or SEO, all sorts of all the things that need to happen these days to get the word out. We could use help, and always looking for people to get involved. And then the second thing is we're, above all, very interested in finding more users. And we serve a very niche type of response agency in that we work with community-based organizations. And a lot of times these are groups that are very much motivated to respond and provide help, but they didn't realize they needed a communication solution. And so that's where our Beacon platform really comes in and can help them. So if anybody watching this knows of any community response agencies that are doing good things to respond in their community, but need a better communication solution, by all means, pass along word about Trek Medics and Beacon, and we'd be very glad to help them out.
Great. Thanks so much for joining us at Summit today, Jason.
Thank you, Olivia, and thank you to everybody at PagerDuty for the awesome, awesome help. We really can't thank you enough.
The world's critical health needs, the very ones that we committed to back in 2019, didn't stop during COVID. In fact, in many cases, they became more dire. The pandemic disrupted decades of healthcare improvements. Childhood immunization programs have been interrupted in nearly 70 countries, plummeting vaccine rates to levels not seen since 30 years ago. Tragically, child malnutrition has spiked, and we've seen a 100% increase in deaths from malaria in sub-Saharan Africa. So simultaneously, while we are ensuring our platform funding and partnerships are helping to advance vaccine equity and distribution, we've also been feverishly working to bolster organizations that are using PagerDuty to ensure access to essential medical care when and where people need it most. International Medical Corps is one of these incredible partners. They are on the front lines everywhere, from India to Syria, Colombia to Sudan. And they provide life-saving healthcare to children, families, and communities who have lost everything because of conflict, disaster, and disease. We know the most effective way for us to help organizations like IMC scale their impact is to offer integrated support that pairs our cash grants with product credits for our platform and specialized technical employee support to help them implement PagerDuty in their life-saving work and giving them visibility and faster incident acknowledgement times during emergencies and unplanned outages. This year changed us all, and we each have a duty to respond to the global need. We may not see it or experience it in our day-to-day, but we have an imperative and also an opportunity to act. We need your compassionate, innovative minds coming together as a global user community to dream up new PagerDuty use cases to create a responsive world where everyone has the freedom to thrive. So I want to give you 2 ways today to be part of this change. Number 1, if you've been inspired about ways to use PagerDuty to do this work, send me an email as we speak. For everyone else, there's another way to make an impact right now. You can give $5 to purchase 1 vaccine to safeguard the life of someone you will never meet. You can check out details at the PagerDuty.org booth or look for campaign details in the Summit feed. Thank you.